Okay, so, first, any questions about the last slide? Okay, so sonographic terminology. Alright, first we're gonna review what we already went over. What does heterogeneous mean? Different textures, okay. So heterogeneous, heterogeneous. There's two ways to say it. I use both of those ways interchangeably, so you guys can hear both, and it just kind of depends on my mood also. What about homogeneous?
Uniform in texture.
Same, right. Homogeneous, homogeneous. Okay, same thing, just two different pronunciations. Alright, what about isoechoic?
Similar in texture to surrounding.
That's right, yeah. When we're comparing two echo textures and they're the same, it's iso. Alright, what about hypoechoic?
Low echo.
Less echoes, yeah. So it's going to be darker than what you're comparing it to. What about hyperechoic? More echogenic, yeah. So more echoes, it's going to be brighter than what you're comparing it to. Echogenic, yeah, same thing as hyperechoic. And then anechoic. Yeah, without echoes, it's going to look black. Okay, so criteria for identifying abnormalities, right? After we've done a survey of our area of interest, and you've identified normal, then you're going to document anything that's abnormal, and then we're going to describe it in our notes. Alright, so the first thing that we have is something called shadowing. So this is an artifact, and it's caused by reduced transmission of sound. So the sound beam is coming through here, and it hits something very, very dense. And that sound beam is not able to penetrate this structure. So it creates shadowing underneath it, posterior to it. Okay. So does everybody see this right here? This is posterior shadowing. And we have a gallstone right here. These gallstones are, it's like a condensed bile. And it's super, super, super dense. And a lot of times you will have echogenic structures that are super duper dense, that sound beam cannot penetrate, and will create this shadowing. Sometimes it's calcified. So this is not a calcification, this is gallstone. It's made out of bile. But this is as bright as bone. Okay, so this gallstone is as bright as bone. I don't see another bone in this image, but your bones will show up very, very bright, just like this, because bones are calcified. And the ultrasound beam cannot pass through bone. So you'll have posterior shadowing underneath it. So anything that is really, really, really dense, you'll have posterior shadowing. Any questions about that? How do you know the difference? Because I know that gallstones don't become calcium. They're not made out of calcium. So if something is calcium, that means that calcium has injected into it and caused it kind of hardening, but that doesn't happen in the gallbladder. So you might get calcifications in the kidney, like a kidney stone, that's a calcification. Or in the bladder, also vessels can become calcified. Did you have a question? No.
Describe this.
You would describe this as an echogenic shadowing structure. So we'll get into piecing all these words together and how to describe stuff. So just one step at a time. So this is posterior shadowing. So if this gallstone moved around, which I'm sure that it does, you would call it a mobile echogenic shadowing structure. So we don't ever identify what the pathology is by name, because that would be us diagnosing, and we do not diagnose. So we're not going to call this a gallstone. We're just going to call it an echogenic shadowing structure.
Do those move as the patient moves? So like if you rolled her over, you're
Yeah,
gonna
so
see it
you
move?
roll them LLD.
That is so cool.
Yeah, and then it'll roll right into the fundus.
That is so cool.
Would you have to get like a video clip to verify it's mobile?
You can if you just want to give the radiologist a thrill. But you would just take an image like this, and then an image with the patient rolled over, showing that it moved. Yeah. So this is an example of a calcified structure. So this is a kidney, and here we have this echogenic structure here. Can everybody see that it's echogenic?
Mhm.
Yeah. And that sound beam is hitting it, and it's creating a shadow. You see that shadow going all the way through? Yeah. So when it's going to prevent any of the sound beam from penetrating this. So you won't have any information posterior to it. There will be a shadow. Any questions about that? Okay. All right, attenuation. So attenuation is caused from the, all right, so let me just read this. Phenomenon in which the amplitude and intensity of ultrasound waves decrease as they travel through the tissue. Okay, so what we have here is a fatty liver. Okay, hepatic steatosis. It's pretty dense. It's pretty big, and the ultrasound beam is hitting it, and as it's going through, we're kind of losing our intensity of the beam. We're not able to get all of the information that we need posterior. So this is the far field, and it's posterior, and the sound beam isn't quite giving us all the information because of attenuation. So if we have a very large patient, and we're using, would you use a high frequency transducer or a low frequency transducer if the patient is really, really big?
Low.
Low. You're going to use the lowest frequency that you can. And even still, it's not going to be enough to penetrate all the way through and get all the information that we need. Does that make sense? So when this happens, and you guys will learn more about this later, if you put your ultrasound probe down and you're getting black where there should be liver tissue, then you're going to decrease the frequency on the machine. And that's something that you guys will do as you're scanning, is decrease the frequency or increase the frequency when you need it. And we'll teach you guys how and when to do that. Okay? But for now, just understand what attenuation is. Yeah.
also change the brightness of it?
You can, yeah, so you can TGC through this and try and make it brighter, but most likely you'll just have to decrease the frequency. If you decrease the frequency all the way on the machine and you're still getting this, then yeah, use your TGCs. Yeah, good question.
What's the minimum frequency we can use?
What's that?
Minimum frequency for the
Name of the frequency?
minimum frequency.
Say it again.
Minimum.
Minimum. Yeah, so if you're using this, the SC5, and the frequency I think actually starts at 6, then you would decrease it to, there's a little notch on here to decrease the frequency, and it probably goes down to 2. There's also a setting that you can choose called penetration, and And that might bring it down to like 1.5. It's different for every machine. So any other questions about attenuation?
Between that and like shadowing, I mean, is it because your whole posterior is not, like if they showed us a picture for a test, it kind of looks like it's shadowing behind, but is it because it's the whole one and not just like a ray of shadow?
Yeah, so the shadowing will be a focus.
Okay,
So this is a focus.
okay.
And if there was, and it's not because the whole structure, all of this is making us lose intensity. It's just this one structure.
Okay.
Yeah. So this is just losing information because we can't penetrate through all of this tissue.
Okay.
Yeah, so it's not shadow, it's just a loss of information because the sound beam can't penetrate all the way through. Does that make
Yeah.
sense? We also have enhancement, and enhancement really helps us with cysts. Does everybody know what a cyst is? So if you don't know, it's just a pocket of fluid. And sometimes we come across pathology and it's hard to differentiate whether it's something solid but very hypoechoic, or if it's a pocket of fluid and with just fluid inside. Okay, so what happens with enhancement is very fast transmission of the sound going through the structure. So right here we have a kidney cyst. It's a really big cyst. And underneath it is really bright echoes. So what happens is the sound beam hits that fluid, goes through it really fast, and creates this enhancement posterior to the structure. So this will happen with fluid-filled structures. This enhancement will happen with the gallbladder, it'll happen with the bladder, with cysts, with abscesses, and sometimes even solid structures that have a fluid component.
Does it happen with like the ones filled with blood too?
I think the blood is viscous enough that it doesn't create that enhancement. Sometimes it does though. Yeah?
Can you repeat how it creates that? enhancement again?
So the sound beam goes really fast through it.
Okay.
Okay, so in more like physics terms, it's an area of brightness seen distal to a weakly attenuating reflector. So attenuation is when your tissue is so dense that the sound beam can't penetrate through all of it, and you're going to lose information in the far field. Okay, so the opposite of this is something not so dense, and the sound beams go right through. So that's what happens with fluid. The sound beam is going to go right through, so it's enhanced through transmission. So it's the through transmission that's faster, and it creates this brightness just posterior to your fluid-filled structure. So does everybody see this? It's called enhancement. So it's just posterior to this fluid-filled structure. And how would you describe this fluid-filled structure? Anechoic, yes, absolutely. There's nothing in it, there are no echoes, it is anechoic. What's that? It's a simple cyst, yes. Any questions? Okay, so the through transmission, that's the transmission of the beam going through any of your structures, okay? so it can either be increased, like it does in a fluid-filled structure. It's increased and it goes right through really fast. Or it's decreased, such as with a fatty liver, with attenuation. So the through transmission is decreased. With the posterior shadowing, it's decreased to a stop because we're not getting any more information posterior to that really dense structure. Or it's unchanged, like most of the structures. So the sound beam will go through a normal liver and it won't create any kind of artifact posterior to it. So if your mass has enhancement, so let's say it's a fluid-filled cyst, it has excellent transmission. That beam has transmitted itself excellently through the structure. A mass with shadowing has poor transmission. So the beam cannot pass through that very dense structure. Does that make sense? Yeah, y'all just let me know if I say something that doesn't make sense, and I'll evaluate what came out of my mouth.
What other factor am I, okay, so I know like liquid, it travels slower, right? Sound travels slower going through a liquid than like soft tissue, correct?
Is that correct? I think it's faster.
I think the physics book, right? I think it was 1.54.
Yeah, solid is faster. It goes the fastest through bone.
Yeah, so liquid is slower. So is it like a
Okay,
buildup
so
of?
we're talking about two different ways.
Okay.
Okay, so it's the transmission. Yeah, you're gonna have to split your brain and think about it two different ways. Yeah. This is a tough one. And you asked a difficult question.
Sorry.
I have to, no, it's okay. No, I mean, I should be able to explain this to you guys, but I'll have to think about that later and put it into different terms. But for now, just think, split your brain from physics. And that when you see this, think excellent through transmission. Okay. Yeah.
I'm wondering if it's the echo that's having a hard time going back through that liquid and there's a buildup of that light there. No?
No.
Okay.
It's gonna have a hard time getting through bone. So it's
Okay.
gonna hit the bone and it's gonna bounce back.
Okay,
But it's going through this very easily.
okay. I'll split it, it's cool, it's gonna be okay.
I'll try and work it out and then I'll write something up tonight. Maybe tonight, maybe over.
It's okay.
Well, I want you guys to be able to understand this and relate it to physics, because this is physics too. So yeah, I'll work on it. All right. So texture of the parenchyma, homogeneous or heterogeneous. So this is an example of a homogeneous liver. Okay. Huh?
Is it sweet?
Yeah.
That was a question
That
on
was
the
a
test.
question on the test.
Oh, okay.
The little black circles were making me question myself,
Oh,
but I
These
was
are
like,
vessels.
Those are the vessels.
okay,
Yeah.
yeah.
These are
So I'm glad
normal
I'm
vessels.
homogeneous.
Yeah. So what can be confusing about this is because you're looking at it and you're going, well, there's all these like little white specks. There's black stuff in there. How is this homogeneous? Well, you're looking at the tissue. So as you will learn about the liver, you'll learn that these are vessels and they're totally normal. So how you're going to identify normal homogeneous liver tissue, now you take a sample. Is this part here the same as this part over here? Right? Echogenicity wise? This is uniform. This is a really nice liver. You can't see it all, can you? So this is a smooth liver parenchyma. Okay. This is a cirrhotic liver. Can you see the difference?
Yes.
Okay, so when you evaluate the capsule, so this is the capsule up here. If you were to zoom in on this, you would have a really smooth capsule. As you can see here, it's not smooth, it's really jagged. And even though this might look like it is all uniform, but you'll learn that this is a very heterogeneous liver. So looking at liver tissue can be really tough to distinguish between a normal, smooth, homogeneous liver or a really coarsened liver. This is obvious. Sometimes you'll have patients that have elevated liver enzymes just slightly, and their liver might just slightly be coarse. It's really hard to tell the difference, okay? And I don't have any tricks other than experience. So the more that you see, the better that you'll be able to pick up on it. But can we kind of see the difference for now between this heterogeneous and this homogeneous liver? So borders. So borders are going to be the outline of a structure. They can be smooth and well defined, or they can be irregular. So a smooth, well defined border is also described as being well circumscribed. Okay, so these are words that we'll use interchangeably. Smooth, well defined, or well circumscribed. Those are all terms that are going to describe a normal, well visualized border. So if you guys can see here, so this is another kidney cyst, and we have an echogenic wall around it. Do you guys see that? All right, so you see this echogenic piece right here? That's the wall, and it goes all the way around. We can measure this very easily. You guys see that? On the other hand, you have something irregular, or ill-defined, or poorly circumscribed. These are all words that are interchangeable. Okay, irregular, ill-defined, or poorly circumscribed. Spiculated is something else I'll talk about that in a second. So do you see this mass right here? It's really hard to see where the mass ends and the soft tissue begins. We can kind of make it out, maybe enough to put some calipers on it, here to here, here to here, but it doesn't have a really nice wall around it like this one does. You guys see the difference? So this, I would describe it as being irregular and ill-defined border, or poorly circumscribed. Spiculation is a very specific term for spikes, okay? So this is breast cancer. This is also breast cancer. So a spiculation will be almost exclusively used for breast cancer masses. Sometimes you'll see a spiculation in other parts of the body, but most of the time it's going to be something like breast cancer. And that you see where these parts of this mass, and this really hypoechoic mass right here, it has these spikes coming out. It looks like, have y'all seen Beetlejuice? The old one? You know? The sculpture that the mom made.
Yeah.
The chair. Yeah, was it the chair? Well, anyway, that's what it reminds me of. So these spikes, that's called spiculations.
So the difference between this anechoic and this solid?
This is not anechoic. So if it's anechoic, that means that there's fluid inside. And if there's fluid inside, what would it have underneath?
Enhancement.
The top one's
Enhancement.
anechoic.
Yeah,
The top one is anechoic.
this is anechoic.
The bottom is heterogeneous.
These are solid masses. Okay, so this is a solid mass. A solid mass. What's that?
Heterogeneous.
Yeah, you could describe this as being hetero if you're taking into account all of it, or you could describe it as hypoechoic. But a solid mass, you would never describe it as being anechoic. Anechoic is strictly for a fluid-filled structure. So this mass right here, you could use hypoechoic or heterogeneous. It's mostly hypoechoic, but you do have some kind of lighter areas within this mass, and so it's okay to call it heterogeneous.
Is that shadowing under?
So this is the chest wall. No, it's not shadowing. Yeah. So this is just, this is the breast tissue from here to here, and then underneath here would be like your chest cavity. So it looks dark down there. The same thing down here. I think this is chest cavity down here. Any questions about borders? Okay, so some more border work. So right here we have an abscess. I can see this heterogeneous area here, but where does it start? Where does it end? It's really
Ill-defined.
hard to tell. So for these borders, how would you describe this?
Irregular.
Ill-defined.
Ill-defined.
Ill-defined, yeah, poorly circumscribed, yeah. All right, and then we have some other, another renal cyst, cool. How would you describe this? Well-defined? Well circumscribed? So, yeah, I know, it's easy to get those mixed up. And smooth, yeah, for sure.
Can you tell me, like, right there, that it kind of looks like it's going out from my angle, like in that white part, kind of looks a little spiculated. Will it not?
So that's called a phlegmon.
Oh,
Alright,
okay.
so, spiculated, we're gonna, mainly use that for a solid mass
Okay.
with spikes. So with your irregular fluid collections, such as an abscess, this nasty fluid can infiltrate into the tissues.
Oh, okay.
Yeah,
Okay.
so that's called a phlegmon.
How do you spell that?
Phlegmon. Phlegmon.
That's an interesting word there.
And the echogenicity for the second object is.
Oh, wait.
This one? Anechoic, yes.
No group.
It is a cyst with no echoes inside. Well, we've got a couple echoes right here. I'm not exactly sure what that is, but it's on the periphery. I wouldn't worry too much about it. It might be part of the wall. I'm not sure what that is, but yeah, for the most part, this is anechoic. Mhm. I have to remember why I put these up here.
What would you call it? Borders.
Okay, so yes, how would you describe these borders here?
Poorly circumscribed.
I mean, they look smooth, but they're
Yeah.
they're
Irregular.
irregular.
Definitely irregular. So yeah, you can put calipers on this real easy,
Yeah.
but they're definitely irregular, and this is called lobulations.
Okay.
Okay.
Hypo. Echogenicity hypo.
Yes. So why is this not anechoic?
Because there is some echoes.
It looks hetero.
Low level.
Yeah, there's some little white speckles in there, but for the most part, this is hypoechoic. But why, how do I know that this is not fluid filled?
You don't.
There's
see
no
any-
enhancement.
There's not-
There's no enhancement. Okay, good, good. So this is a kidney, and right here is dilated ureter, and it's filled with urine. How can we tell that it's filled with the fluid?
The enhancement.
Yeah, there is some enhancement down here.
So the top ones are masses, they're not fluid, they're like a mass or something?
Say it again?
Are the top ones masses then?
This, yes, this is a mass.
Hypoechoic liver with.
Yes.
What is that white line on the bottom of those masses? Like there's a little.
Right here?
Yes. What would you
I
call
think
that?
that's just the wall of, yeah, I think it's the wall.
Okay, so enhancement would be a thicker white, correct?
Yeah, so not just the wall posterior to it, it would be like all of this tissue
Okay.
is bright.
Thank you.
No problem. Yes, ask your questions, please. Yes,
So if it's anechoic, would it also have shadowing or just enhancement?
enhancement.
When would something have shadowing?
So
Would
if
be
it's,
solid?
if it's
Hypo?
very, very dense, if it is if it's a stone, like a kidney stone, for example, that's very dense. A kidney stone is calcified. It's going to be as bright as bone, and that sound beam is going to hit it, and it's not able to get any information posterior to it. So that's what creates the shadow.
So can the structure be hyperechoic and hypoechoic?
You will rarely, or ask that question again, if you don't mind.
If the structure, if it has shadowing, it has to be either hyperechoic or hypoechoic, or is that different?
It just
Because
it depends on the density of that structure. So most of the time, a structure that's very echogenic, if it is very dense, then it's going to shadow. Sometimes a hypoechoic mass will shadow, it just depends on how dense it is. So sometimes these breast masses, where did the breast mass go? Here. Sometimes structures like this, of breast cancer, is so dense, it will create shadowing posterior to it. Okay, so it's not always, the structure's not always going to be echogenic that shadows, but most of the time it will. Okay, it just depends on how dense it is. Okay, so once we identify something that's abnormal, and we're going to have to determine its makeup, whether it's a solid or fluid mixed, the radiologist must be informed if it is fluid filled. Okay, you have to say in your notes to the radiologist, once you find a mass, then we're going to say in our notes whether it's cystic, complex, solid, or calcified, or if it has calcified components. So let's talk about that. So a cystic structure is going to be smooth with well-defined borders and is anechoic, and it has increased through transmission. So we'll see cysts all the time. That's going to be probably the most common pathology that we'll see. Just about everything in our body is capable of having a cyst. So we'll have our smooth borders. They will be anechoic, most of the time. And you'll see this through transmission. Do you see that? The enhancement? Okay, so that is signifying to us, or signaling to us that this is a cystic structure. Sometimes a cyst can have echoes in it, such as a gallbladder. If somebody hasn't eaten for a long time, they can get something in there called sludge, and that'll appear as kind of echogenic material in the gallbladder. If you have material in a normally just a normal, if it's normally just a fluid-filled structure, and you have echoes in it, it's no longer anechoic. Okay. Anechoic means that there's no echoes inside of it.
So what would you call it?
You can call it a complex fluid collection.
Oh.
Yeah. So it's no longer simple. Now it's complex because there's something going on. Okay. So let's say these together. What are the characteristics of a cyst?
Well-defined borders.
Okay. And then what's the echogenicity of it?
Anechoic.
Anechoic, okay. What will you have posterior to it?
Enhancement.
Enhancement, good. And a well-defined posterior wall. So the through transmission is allowing us to see that posterior wall really, really well. Okay. When a normal fluid-filled structure has echoes in it, now it becomes complex. So these structures have the characteristics of both a cyst and a solid structure. So what we have right here is most likely an ovarian hemorrhagic cyst. So we get cysts all the time in our ovaries, and they pop. We would never know. Sometimes if you feel like a sharp pain down there, that might be an ovary cyst popping. But sometimes they can be filled with blood. That's a hemorrhagic cyst, and we know that it's filled with blood because now we have all these echogenic strands going through it. So as blood sits for a while, it becomes fibrous, and it starts making kind of a lacy pattern. So that's what that is. All right. So now it's no longer a simple cyst. It is complex. And then we can see all this enhancement posterior to it. Y'all see that?
So it's inflammation around it.
No. This is just enhancement. What do I say about inflammation?
Underneath it says the surrounding echogenic areas can be inflammatory response.
Okay, so could be, yes. So this is enhancement. This is way too bright to be inflammation.
Okay.
So that is something that you have to be aware of.
Okay.
That if something is infected, it's also going to affect the tissues around it,
Okay.
and that can become an inflammatory response and just make everything around it echogenic. But it won't be this echogenic.
Okay.
Like, this is really echogenic. So with the inflammation, you'll still be able to make out the structures. It'll just be a little bit brighter than usual.
I have a question about like the blood. So when it starts to like sit there and form like the red, is it like the blood starting to clot?
Mhm.
Or-
Yeah. Yeah.
So have you ever seen like an ovarian cyst like with the blood clots? Is that weird?
This, like hemorrhagic cyst?
Yeah.
Yeah. Yeah. So the blood, I mean, we see blood all the time, loose blood, blood that's not within the vessels. And it takes on different characteristics depending on its age. So you guys will have more of that later on. But when blood first appears somewhere, it's going to be anechoic, and then after it sits for a while, it becomes more echogenic, and then it finally starts to kind of break down. Alright, so now we have our solids. You should have most of the time, a discernible border. Alright, and then we're gonna have internal echoes. And a solid may or may not have shadowing. Sometimes solids have a fluid component, but if it's mostly solid, we're gonna call it a solid. So there might be some increased transmission right here, but it's not throughout, and it's not anechoic. So how would you describe the echo texture here? Yeah, it's heterogeneous for sure.
Would we still call that enhancement?
A little bit of enhancement.
Okay.
So there might be a small fluid component, there might be a fluid component up here, but it's mostly solid. So we're gonna call this a solid.
And well defined.
It is well defined, yes.
Would you call that a smooth border or more, because in some spots it looks lobulous.
Yeah, it's lobulated, but for the most part, it's well defined.
Okay.
So you can say well-defined lobulated border.
Okay, so that's not like counteracting each other.
No. And then you guys will learn more about edge shadowing in physics. So round structures can have this edge shadowing, so as the beam is coming around the border here on the sides, it can create shadowing. So don't let that fool you into thinking that there's pathology just because there's shadowing on the edges. Okay, so we see it here, this edge shadowing over here. Any questions about solids? And we'll do more of these, we'll do more examples. So the more that we do of these, you guys will, pick up on it, because I'm sure you guys are all like, oh, how am I gonna determine any of this stuff? So don't worry, we'll do more examples. Why did I put this on here? Okay, so what do you guys think about this? Is it cystic or solid?
Solid.
Solid, yeah, how can you tell? Yeah, no enhancement, it is heterogeneous. If this was totally anechoic with enhancement, I could say for certain that it was cystic, but we have so many different echoes in here and no posterior shadowing. I'm pretty confident in saying that this is a solid.
How would you define the border?
I would say that it's ill-defined,
Okay.
irregular.
Irregular.
Yeah, irregular, yeah. And you can see it mostly, and then we're kind of losing it right here.
Uh-huh.
So it's definitely irregular.
Okay.
Yeah.
So if it's not 100% well-defined, we're gonna go with the regular.
Yeah.
Okay.
Yeah. Yes.
So if this were on a test, we could say solid with irregular border.
Yeah. Okay, calcifications. So it is a solid. So a calcified structure will always be solid. It's echogenic, or you could call it hyperechoic. So a calcified structure will always be echogenic, but not every echogenic structure is calcified. Okay? So any type of, nope, this is wrong. Not any type of stone, my bad, because a gallstone is not a calcification. So a stone in the kidney, yes, it's calcified, because those kidney stones are made out of calcium. A stone in the ureter or the urethra is calcified. A stone in your bladder is calcified. And most of the time, there will be shadowing underneath. So there's gonna be shadowing posterior to our bones, posterior to any kind of kidney stone. But not every kidney stone will have shadowing. So it depends on how old the kidney stone is, how dense it is. And especially in the kidneys, if you put your color box over the kidney stone, it'll give you an artifact called twinkle artifact. Let's see if I have. Okay, yeah, I'll show you twinkling in a second. So here we have a gallstone. Not a good example. This is not a calcification.
But they're shadowing.
There is shadowing,
But it's not calcium.
but it's not calcium. Right, so this is the twinkle artifact. Right, so there is this stone right here. It's hard to tell because there's so many other echogenic parts of the kidney. Like there's all these vessels, there's pieces of fat that are in the kidney that look echogenic. But if you put the color box on something that's echogenic and it gives you this this twinkle artifact, that is your big clue if it's a stone. But not every stone is going to twinkle, but most of them do. Okay. Yeah, because there's never an always. Yeah, it's most of the time, you know, what we tell you is the truth, but sometimes there's exceptions.
Just calcified diamonds twinkling.
What's that?
It's like diamonds twinkling, like certain special.
Yeah.
So
Yeah.
a gallstone wouldn't twinkle because it's not calcified?
Gallstones, I don't think that they twinkle. There are other things in the gallbladder that will twinkle, like air. I can't remember what it's called, pneumocystitis or something like that. So you'll get this artifact in your kidneys, and then over air, you'll get this artifact.
What is it caused by? Is that going too far?
Is it twinkling?
Uh-huh.
Yeah, you'll learn that in physics.
Okay, tell me when to stop.
No, it's okay. Okay, so how would we describe the echogenicity of this mass right here?
Hyperechoic.
Hyperechoic or echogenic? Good. What about the borders?
Well defined.
Yeah, they're pretty well defined. Is it a solid or is it cystic?
Solid.
Solid, good. How do we know that it's a solid?
No enhancement.
No enhancement, yeah. Is it calcified? It's echogenic. Is it calcified?
If it was calcified, it would have shadowing, correct?
Yes.
Okay, so then
Yeah.
no.
It's big enough that if it was calcified, yes, this big old structure right here will give you shadow.
So it's not calcified.
It's not calcified.
What and where is that? Is that a
This is kidney, and this is probably an adenoma. Okay, so do we see this mass right here?
Mhm.
How would you describe the echogenicity?
Hypoechoic.
Hypoechoic, yeah, almost isoechoic. And yes, it is hypoechoic, but just by a little bit. How would you define the borders?
That's kind of hard.
Yeah, it's pretty irregular. So we do see a border here, but we're losing it here. I can put calipers on it, sure, but the difference between the mass and then the liver tissue is really ill-defined right here. Okay. Is it a solid or is it cystic?
Solid.
Solid. How do we know? No.
It's heterogeneous? No.
No.
Enhancement.
Enhancement,
No
that's right, okay. So I would describe this as a hypoechoic, hold on. Hypoechoic solid mass in the liver with no posterior enhancement. Okay, so it doesn't look like there's a fluid component in this at all. Okay.
Would you say heterogeneous or homogeneous?
For the mass,
Yeah.
so it's, you wouldn't normally describe a mass as being homogeneous.
Okay.
You can, but homogeneous is going to be reserved, normally reserved for
For
normal
organs,
liver tissue.
okay.
Do the masses ever, like, say that one's in the liver, right?
Uh-huh.
Would it ever be, like, because there's a structure that connects to the liver as well, like spread to the?
Yeah, the metastases.
Okay.
Yeah. So what you can see sometimes is a mass in the IVC that is, okay. A mass in the kidney that extend, and then the mass now extends through the renal vein and into the IVC. So, yeah, that's a mess.
So when you find a mass, you wanna follow it and make sure you get, not.
Yeah, you wanna see everything around it too.
Okay.
Yeah. And if there are any lymph nodes, so, when you do breast, if you find a mass anywhere in the breast, you're also gonna check the lymph nodes here. Yeah, so that's checking for mets to the lymph nodes. Mhm. Okay, so what's the echo texture here? How would you define the echogenicity?
Isoechoic.
Barely high.
And say hypo.
Yeah, so this is hypo, barely, it's just like the other one. It's just a touch more hypoechoic than the liver tissue out here. So what about the borders? Irregular, yeah. So I would say lobulated and irregular, yeah. You can see the border here, but we start to get out here and I no longer am making out a very well circumscribed border. And is this a solid or is it cystic?
Complex.
Solid, yeah. So don't let the diaphragm fool you. So this is the diaphragm, it's very echogenic. So looking right here, I mean, you can see that this is the same here, right? So this isn't necessarily posterior enhancement, we're just getting echo, very strong echoes from the diaphragm. So yeah, this is a solid. So I would describe this as a homogeneous solid mass in the liver with irregular lobulated borders. Does that make sense? Okay. You can also describe this as being heterogeneous. So yes, for the most part it's hypoechoic, but you can also describe this as being heterogeneous because there is a mix of echoes in here.
But you said you would normally describe the mass.
As homogeneous.
Oh.
Yeah. So homogeneous, I will reserve that for normal tissue, but you can definitely describe a mass as being heterogeneous.
Is that, can you describe to me how that's viewing the diaphragm? Like, I'm trying to think of it like the cut. How is the probe hitting it? Where are we?
So this is in sagittal,
Okay.
and so this is your superior diaphragm,
Okay.
and then this is inferior.
Okay.
Does that make sense?
Kinda.
And it's a sheath. Yeah, so it'll look like this in transverse and in sagittal. It'll just be this like echogenic line like this. We'll never see it like a flat piece.
Mm-hmm.
It'll always look like this, no matter what plane you're in. Okay. So what's the echogenicity of this structure?
Hypoechoic.
Hypoechoic, okay. And what about the borders? Yeah,
It's hard to
so
tell when
they're
it's shadowed.
well defined, yeah, there is shadowing down here, but we can still kind of see the difference between the mass and the tissue beneath it. Can you kind of see that? Yeah, it's not smooth, but for the most part, I would say that this is well defined. Okay, is this a solid or is it cystic? How do we know that it's solid?
Shadowing.
Yeah, this is really solid. So this is an example of a solid that is hypoechoic. It's really, really dense, and it's creating this posterior shadowing.
Do fluid filled ones, they don't have, or complex ones, do they never have shadowing?
If there's calcified structures inside.
Okay.
Okay, what about the echogenicity here? Hypo, yeah. And what about the borders?
Well defined.
A little irregular on that side, right?
It's a little irregular. It's hard to tell here. Over here, it becomes a little bit isoechoic, right? We can see it here. We can definitely see the posterior border, but it's a little bit irregular. Is this a solid or is it cystic? Solid, that's right. There is a cystic component, but it is well over 50% solid. And how can we tell that it's a solid?
Is this shedded here?
Right here?
Yeah.
No. This could be some edge shadowing, but it's not shadowing from anything pathologic.
So is it not complex just because it's such a small portion of it that's cystic?
Yeah,
Okay.
yeah. So if it's like half and half, if it's half cystic, half solid, then it would be complex. If you have most of it solid, then yeah, it's solid, with just little areas, probably little areas of necrosis. All right, what about this? How would you describe the echogenicity here? Anechoic, good. And then what about the borders? What about the borders?
Well defined.
Well defined, okay. And is this a solid or is it cystic?
Cystic.
Cystic, yeah. There are no echoes in here. It is a very large, I don't even know what this is. If it's a cyst, I think this is an ovarian cyst.
What about the bottom part? There's like a little bit of discoloration.
Right here,
Yeah.
this is artifact.
Okay.
Yeah. So sometimes you will get debris that settles posteriorly, but also you'll have this, this kind of artifact. You guys will learn this in physics. Yeah. So no,
Keep
it's
asking you
okay.
physics
A lot of
questions.
this coincides with physics. The way to counter echoes like this, turn gain down. You're gonna decrease the gain of the entire image, and that should help here. So we wanna make sure that our cystic structures do in fact look cystic. You'll adjust your gain, you'll adjust your TGCs to make sure that it doesn't look like there's any echoes in that cyst, if it is truly simple.
Do you label artifacts or anything wrong with them? You just change it and you avoid them?
An artifact like this,
Yeah.
so we adjust our settings to try and get rid of it. Sometimes you won't be able to without sacrificing the integrity of the structure around
You
it.
don't label it.
No, don't label it, no. You would write in your notes, artifact, appearance of artifact within the cystic structures. All right, what's the echogenicity of this right here?
Hyperechoic.
Hyperechoic or echogenic? And how would you define these borders?
Nice where that shadowing is. It kind of.
Yeah, so,
I would say regular.
yeah, definitely irregular. I mean, it's not smooth, but we could put calipers on there, for sure. Is this a solid or is it cystic?
Solid.
Solid, yeah. How do we know that it's solid?
Shadowing.
Shadowing, yeah.
I see an angel
Is
stitch.
it calcified?
Yes.
Yeah, yeah. So this is a calcification. I think this is the liver. This is either liver or spleen. And they've got a random calcification. Okay, so now we have another breast mass. How would you define the echogenicity here? Hypoechoic, exactly. Why is this not anechoic? It's solid, yeah. How do we know that it's solid?
No fluid, no enhancement.
There's no enhancement. That's your clue. There's no enhancement. How do we define these borders? Spiculated. Yeah, yeah. Spiculated, irregular, for sure. And yeah, so we've determined that it is a solid. So that is breast cancer.
Breast cancer looks really scary.
It does look scary.
I have to really work on my poker face.
Yeah, we'll talk about poker face later. All right. How would you define this structure here? So just this tissue inside of the structure.
Isoechoic.
Isoechoic, yeah, for sure. What about this border? Well defined, absolutely. We have this posterior rim. This is called eggshell calcification. Is it solid or is it cystic? Solid, yeah. How do we know? No enhancement, yeah. And we have this edge shadowing here. All right, what's the echogenicity here? Hyperechoic or echogenic. And what about the borders?
Irregular.
Yeah, irregular, lobulated. Yeah, we can put calipers there. We can definitely tell where the normal tissue is versus the mass, but it's not beautifully round and well circumscribed. It's definitely irregular and lobulated. All right, and is it a solid or is it cystic? Solid. How do we know?
Shadowing.
Yeah, you see all that shadowing? That's a big calcified structure right there in the liver. All right, any questions about those?
No.
All right, so I have a little bit more practice. Let's do that, and then we'll get out of here. I have the answers right here. All right, so how would you describe the echogenicity?
Well, circumcised. I'm circumcised. No,
Yeah.
no, don't write that.
Yeah, it's heterogeneous. So we have some areas that are really hypoechoic, and we have some areas that are echogenic. So yeah, heterogeneous. And what about the borders? Yeah, they're lobulated, but we can make them out pretty good. All right.
Is that enhancement underneath or?
There is a little bit of enhancement, but so we have kind of a mix going on here. But it is more solid than it is cystic. So we've moved past a complex structure. We're just at solid. So it does have some cystic areas, but it's mostly solid.
Is irregular like the same synonym for ill-defined or lobulated? Or
So lobulated is specific to like it's not round, it's kind of bumpy. Yeah. And then irregular would be like, I see the border, it's just weird. So yeah, but you can't say something is lobulated just because it's irregular.
Okay, so lobulated, I realize the difference between lobulated, I guess, irregular versus ill-defined. Irregular is just not as smooth, I guess, and then
Yeah,
ill-defined,
yeah,
you're
so
not being able
there
to
might
definitely
be-
say this is the border.
Yeah, so with an irregular border, you might have some areas that you can see and some areas that you can't.
Cool, okay.
All right, how would you guys describe the echotexture here? Yeah, that
Heterogeneous?
is, yeah, it's heterogeneous and it's complex. So we have some solid areas and then we have some cystic areas. This is about 50-50. I would describe this as being complex. And then what about the border?
Well defined.
Yeah, I'd say, yeah, for the most part, this is well defined, yeah. We can easily put some calipers around there. It's well defined, but it's not smooth and regular, but it is well defined. Okay, so how would you describe this collection right here?
Heterogeneous.
Yeah, it's heterogeneous, and is it solid or is it cystic? It's complex, yeah, this is a mixture of both. So we have a lot of these kind of cystic areas within it, and there's also a solid component. So this is a good 50-50 mix. This is a complex fluid collection.
Ill-defined border, would you say there's enhancement?
Yeah, there's a little bit of
Right there.
enhancement here, yeah. Yeah, definitely an ill-defined border. We can measure it, but it's really hard to say all the way around. So this is an abscess, all right? And just looking at it, so an abscess is like an infected fluid collection. And so just looking at this, it's difficult to say this is partially solid and partially cystic. So this is when you would correlate clinically. So the patient is going to come in and they're going to have a spot on their skin that's red. If this is an abscess, all right, they're going to have a spot on their skin that's red, it's inflamed. They might have a fever, and their labs are going to show a high white blood cell count. So that's why I know that this is a complex fluid collection. So some of these are hard to tell just by looking at them. You're going to have to know the patient's clinical history as well to make this call. Okay, so when we're looking at body parts or the organs, this kidney, for example, it doesn't look homogeneous. There's different echoes here, but it is. We're just going to we're going to compare the kidneys bilateral or on each side to each other. Are they symmetrically homogeneous to each other, or does one kidney have a lot of extra echoes in the cortex versus the other one? Then they're not symmetrically homogeneous. All right, this is a heterogeneous kidney. Can we see the difference?
Mm-hmm.
Like, look at the parenchyma here. So it's really echogenic, and it just looks kind of coarse. And then compare it to the part of the cortex here where it's really hypoechoic. I think this is an infected kidney with pyelonephritis. So that makes the kidney really heterogeneous, and it looks fluffy. Right, compared to this normal adult kidney, can we kind of see the difference in the texture? So this is a normal homogeneous kidney, and this is an abnormal heterogeneous kidney. All right, and then this is a kidney that has cystic disorder. So eventually, all these cysts will take over the kidney. So this is a kidney that has multiple well-circumscribed cysts within it. You would describe it as multiple well-circumscribed anechoic structures, or cystic structures. So we're not going to describe something as being a cyst, but you can call something cystic. Okay, so cyst is a diagnosis, but cystic is just kind of comparing it to cyst.
Can you point out, draw out the edge of the kidney?
Okay, yeah, so this is the superior pole around here. Okay, so midway, and then here's inferior pole here. When you're scanning through, it would be easier to identify the tissue, yeah. Alright, so right here we have fluid collection, and free fluid in the body is pathology. So fluid should be in something. We should never have fluid just floating around. So what happened here was appendicitis that ruptured, and now we have infected fluid in the cavity, and this could be what it looks like. No one fluid collection ever looks the same. But what happens is it infiltrates into the surrounding structures. They're normally very ill-defined, and this is definitely complex. You see how heterogeneous it is? So we know that it's a fluid collection because this patient had appendicitis, they had the surgery, and now they have pain that's persisting. So usually when that happens, when they have pain that persists, they have some kind of infected fluid collection going on in there. And it's ill-defined. There's a little bit of posterior enhancement here. But yeah, something else that you would have to clinically correlate. So you know the difference between finding a fluid collection versus something that's solid. Okay, so more examples of a homogeneous liver. So here we have a normal homogeneous liver. This is a fatty liver. It is still homogeneous, but it's really echogenic now. So you'll see this. This will probably be the most popular pathology that you'll see out there is fatty liver. So many adults coming in with elevated liver enzymes, liver function enzymes, and you'll see just a big fatty liver. So what's happening here with the ultrasound beam? We see it clearly up here, but down here we're kind of losing some visualization of the far field. What is that called? Attenuation. Very good. All right. So we see that the liver is very echogenic compared to this right kidney. So when we do comparisons, especially of the liver, we're always going to be comparing it to the right kidney. So this liver is echogenic to this right kidney. Okay. It's still homogeneous, but it's just increased echogenicity. And now here we have, if you don't control your fatty liver, it will eventually become hepatitis, and then the hepatitis will become a cirrhotic liver. So this is the difference between a very nice homogeneous liver and a heterogeneous liver. This is shrunken. There's all kinds of fluid around it. So this is the ascites that happens once you start having a failing liver, and they'll have to do a paracentesis to get this fluid out. So do you guys see the difference between this really coarse heterogeneous liver and then this really nice homogeneous liver? Okay. Another cyst with posterior enhancement. All right, how would you describe the echogenicity of this mass? This is the tissue that we're comparing it to. Isoechoic, yes. And what about the borders? Yeah, well defined, well circumscribed, smooth. Yeah, it's got a nice halo around it. We see exactly where to measure. And it's not really broken up. I mean, as we scan through, I'm sure you'll be able to see that halo going all the way around. Is it a solid or is it cystic?
Solid.
Solid, yeah. So this is a thyroid nodule. You guys will see plenty of those. Okay, so how would you describe the echogenicity of this? Yeah, heterogeneous for sure. You have you have every kind of echo in here. You've got some hypoechoic echoes and really echogenic echoes. Do you see this kind of streak coming off of each of these punctate foci? That's called a comet tail. And that's an artifact that will come off of air, but also these colloid cysts in the thyroid. So that's advanced. But just because it's echogenic and we have an artifact beneath it, it doesn't mean that it's a calcification. Okay, so this is a comet tail artifact. It's not shallow. What about the borders? Yeah, ill-defined. I see something here, but over here, we're really starting to lose it. Yeah, ill-defined. And is this a solid or is this cystic?
Complex?
It looks complex, but I don't see any posterior enhancement down here, and it is mostly solid. I know that we have some cystic-y looking areas, but this is a thyroid nodule and it's a solid. All right, so a lot of times how we describe these pathologies is subjective, okay? How I would describe one thing, you guys might describe it another way, and the radiologist might describe it another way completely. So we just take the knowledge that we have, and we apply it the best way that we can, okay? Because a lot of this in ultrasound is subjective. Describing things is difficult because, look at this, right? But the more that we do, the better that we're going to get at it, okay? So does anybody have any questions? Okay. I think in lesson 1, there's also some more images. But if you guys need more, just let me know. Send me an email, and I'll try and create more slides with these examples. So we good? Any questions?
When would you like the homework?
Yes, the homework will be due by next week. So I'm gonna move the questions onto Blackboard. I'll do that today. I'll do that right now. So look under the lesson for today, and I'll put homework questions on the file. So it's these it's two different videos. Those are already on Blackboard. So you can either email me these answers, or you can bring them to class next Tuesday.
Do we leave our name tags, or are the seniors going to be in here?
Just take them with you. Yeah. Yeah, and if there are any questions, please email me. And what was it that I was going to try and research? It was about the
The
sound.
enhancement